I'm Dr. Tony Urbanek, and we're here today to talk about temporomandibular joint problems. I'd like to kind of fill you in on the problem itself. It's a well-known problem, but poorly understood. It is treated in many different ways, and fortunately I've been able to see thousands and thousands of patients with this and worked out a manner which definitely solves the problem. First, let me explain the problem itself. Temporomandibular joint problems, and here in my office we just call it jaw joint problems. Temporomandibular joint is the name of the joint that is right here in front of your ear. You have two of them, one on each side. So this is a model of the lower jaw. We call it the mandible. These are the temporomandibular joints, the jaw joints. TMJ problems originate here. Each jaw joint has two parts, a socket that goes over it and the ball itself. In between the ball is a little cushion. The cushion is really the problem. This is where all of those symptoms originate, right inside this joint. It's a very common problem. It is seen almost exclusively in women. About 95% of my patients are women, 5% are males. The reason it is so exclusive in females is that estrogen, the female hormone, exacerbates or make worse inflammation in the joint, any joint, and in this case we're talking about the temporomandibular joint, the TMJ, TMD, temporomandibular joint disease, and craniofacial pain. Remember that big complicated word. They cause a long laundry list of problems. Therein lies the problem. Most doctors and most patients get very confused because the symptoms are so diverse and they vary so much. They're very infrequently associated with the jaw joint. But here are the symptoms. Frequent and recurrent headaches, frequent and recurrent earaches, pain that goes down the back of the neck and forward into the jaw, ringing in the ears, fullness in the ears, vertigo, dizziness, and on rare occasions, shoulder and arm pain, and even rarer, shoulder and arm numbness. That is seen not very frequently, but definitely associated with jaw joint problems.